Hi, I'm Shelley Fold-Nasso, CEO of the National Coalition for Cancer Survivorship. Thank you for joining us today for a conversation about managing anxiety, stress, and grief during the COVID-19 pandemic. Last week, we had a conversation with Dr. Otis Brawling, and we received many questions from cancer survivors about their risk and treatment considerations. The fear and anxiety in the questions was really palpable, and we wanted to provide advice and guidance on managing anxiety during these difficult times. We are pleased and grateful to have an incredible panel joining us today. Dr. Imani Price is a licensed psychologist at Women's Inner Fitness and Wellness Center in Maryland. She also serves as the vice chair of the board of directors at Breast Care for Washington, D.C. She has a passion for breast cancer awareness, prevention, and survivorship. Her therapeutic approach is to provide spirituality support and practical feedback to help her clients effectively address personal life challenges. Also joining us today to share their experiences are cancer survivors and advocates, Randall Broad, Erin Cummings, Loretta Herring, and Sharon Rivera-Sanchez. We thank you all for joining us for this important conversation as we all navigate through these uncertain times. And we hope that today's webinar addresses some of your questions and concerns. You can use the chat box to submit any questions you have, and we'll address questions toward the end of the broadcast. And we also have questions that some people submitted prior to this webinar. So now I'm going to turn it over to Dr. Price.
All right, great. So I'm happy to be here and to talk about some of the stressors and anxiety that people are experiencing in the midst of this COVID-19 pandemic. So these are unprecedented times, and many of us are feeling a lot of concerns related to our own health. The uncertainty of the times is leading to many of us feeling depressed. Some of us are feeling anxious, and there's also secondary PTSD that's occurring as a result of everything that's going on. So this uncertainty is making us feel, many of us feel very vulnerable, and like our lives are out of our hands and out of our control. Control of our lives helps us to feel a sense of well-being and ultimately a sense of safety. Many individuals have shared with me that they're feeling similar to the ways they did when they were first diagnosed with cancer. That uncertainty, not quite knowing of what this is going to do long term and how this COVID-19 can impact them and their families. One thing that we do know is that the COVID-19 research is constantly evolving. So it's just something for us to stay mindful of. But despite all of the challenges, I'm encouraging everyone to maintain and reclaim control over their lives. Despite the hunker in place and all the other things that are now in place so that we can stay healthy and safe. So what can we do during these times when most of us are indoors and life looks different than what we are used to it looking? So we were talking yesterday, and I talk about a shift in our mindset. So we're going to shift our mindset. And yes, there are ways that we have done things our entire lives, but because of what we're experiencing now, we're going to make some shifts in the way that we do things. So one of the things that I want you to be mindful of is I want you to be your best advocate. All right. So advocate for the things that you want and don't want. And many of our loved ones and relatives, they might send over articles and other things that they want to be helpful and they want to, share new information that they have received. But it could be too much. And you may have to let them know that thank you, but it's, I will seek information in however way that feels right for me. It's okay to tell people what you want and what you don't want. They're going to be okay. Lovingly, they want to help. God bless them. We're so thankful for that. But with all the other things that are going on, owning your own voice is going to be really important to just maintaining your sense of focus and your sense of balance. Also, I want you to maintain connections and community with other peoples. These virtual platforms are terrific, and we're using one right now, but there's Zoom and other video chats, conference calls, communication apps, emails, IMing people. Find ways of staying connected. Now, it may not feel like when we used to all get together and go to brunch and so on and so forth, but a nice video chat with a group of girlfriends or friends where you guys are all eating lunch at the same time and a glass of wine or whatever you like, and just enjoying conversation is a way to stay connected to community and other people, and you're also able to maintain your safety. What are you passionate about? What is it that really helps to feed your spirit? Find ways of doing those things. So right now we know that because life has changed, there are people in nursing homes, there are first responders, there are veterans, and I'm a veteran too, who are in long-term facilities. We've got our healthcare workers and we've got police officers. Find ways of helping them have a smile on their face. Send flowers, send a card, have a kind word. There are just so many ways of sharing kindness with other people, and I think that it helps us also to just spread something um, to other people that will help them to feel like they're appreciated, not forgotten, and it's good for us too. And then, you know, make sure you're keeping movements and mindfulness in your daily routine. So, movement, some level of yoga, exercise, walking, even within your house, go in your backyard. If you're concerned about, being out and walking in public or anything, if you've got a backyard, or just sit on your porch, find ways of getting some movement and meditation. Um, Doing deep breathing, writing in your journal, doing mindfulness things. In addition to that, eating well, lots of fruits and vegetables. So if you don't bring the junk in your house, I'm not going to mention any names. You won't have it to eat while you're indoors and trying to figure out, now what do I do? And getting plenty of sleep. Sleep is so important, and getting that restful sleep helps to rejuvenate us, and it keeps the mind and body in a good place. Knowledge is power. A lot of times we experience of anxiety because there's all this information coming at us. So my thoughts, be mindful of where that information is coming from and how much of it you're getting per day. So I say an hour in the morning, no more than. Less than is even better. And a little bit at night, if you so desire, is about as much as you need. And the CDC and the National Institute of Health, they have scientific information that you can read about because this is constantly evolving. The information stays current and is relevant. Now, there's a lot of information, and a lot of it is misinformation that's coming at us. And because we're hearing so many different things, it can be overwhelming, or we can start to feel worried like, I don't know what's right and what's not right. But the CDC and the National Institute of Health, they are two very reputable scientific based organizations. I would encourage you to use them for your information. Um, we were talking about there are changes in some of the medical screenings and appointments that we were able to have before all this happened. So doctors are really having to look at the cost risk benefits for having you come in or for having you wait until after the pandemic. So I encourage you to continue to take care of doing self exams, paying attention to your body, paying attention to your organs, looking for any abnormalities or any changes. And if that should occur, then reach out to your healthcare providers. Although most of the outpatient clinics have been closed, and many of the doctors are doing support of the COVID-19 patients. There are still providers and their offices are still open for you to have those conversations and to be able to bring your concerns. I want you to remain vigilant about your health because it's everything, right? So, and then if you're unable to get motivated, if you see that your mood is changing, if you just notice that you just don't feel quite like yourself, then I encourage you to reach out to a mental health provider. There are all of us, including my practice, we're all doing things virtually. There are mental health providers all across the United States that are willing and able to support you during this time. So yeah, pay attention to your own emotions and if anything changes for you. So those are kind of the things that I want to bring to mind. So now I'm going to open it up to our panel for discussions about some of the challenges, the triumphs, and learning experiences that have happened during this time. I want to start with Randy, since Randy is in Seattle, and which is where we, know the COVID-19 started in the Seattle area in the United States. So, Randy, would you mind sharing with us like what some of the challenges and the triumphs and any concerns or questions that you might have?
Randy, you're on mute.
Thank you. Sorry.
Very good. Thank you.
We're being technically challenged this morning. It's only 9 o'clock on the West Coast. It's early. Sorry. And by the way, I'm Randy. I'm not Elena, even though I would rather be Elena, but that's okay. Anyway, like I say, we've had these early morning challenges. Anyway, Dr. Price, thank you. Yeah, I mean, this is a unique time, as everybody knows. And I think being a cancer patient makes it even more challenging in a lot of ways, just because there are so many unknowns and we are at such high risk. I'm a former lung cancer patient, and I, obviously have been reading all the news and everything that goes along with this. So it heightens the amount of stress that was already there. And so it's been a very, very challenging time. And fortunately, I have a really good network of friends. One thing that I have found that has been really, really helpful is we get on Zoom and communicate through that every other day practically. And one of the precursors to getting on Zoom we all share is like, nobody can be negative. We have to be uplifting, we have to be positive, we have to be talking about what's everything that's going on good in our life. So that has been extremely helpful for me. And as you mentioned, this thing really did kind of get kicked off here. And I live in Kirkland, and the facility, assisted care living facility, was about 3 miles down the street. So that made it even a little bit more excruciating, if you will, because I ended up going to the hospital there originally, like 6 weeks ago, to actually get checked to see if I had the virus. And once I got there, I realized I was really in the wrong place. So I couldn't get out of there quickly enough. And in fact, the doctors and the nurses all said, this is probably the worst place you could be. So there's just all these things. But through it all, I would say that one of the great things, being a patient advocate, I have continued to do my advocacy work, and I get a lot of enjoyment out of that. I had one recently of a friend of mine who I worked with for many years. Her younger sister, recently was re-diagnosed with a metastatic from her breast cancer. And I was able to hook her up virtually, if you will, electronically, through several people at Seattle Cancer Care Alliance and through the Fred Hutch facility. And we got some incredible information for her to be treated at this challenging time. And so to continue doing what you're doing and what you like to do and you get enjoyment from means a lot. And that did help a lot. Thank you.
All right, thank you so much, Randy. I love what you just talked about, the advocacy work and putting your energy and your focus into helping to support this young lady. And I'm sure it was very helpful for her, but also rewarding for you. And it will have long-term impact for her as well as helping you to feel like you've helped contribute. And I think that's what it's all about. So I'm going to turn it over to Miss Loretta now. If you share with us what you've been doing in Alabama, you've been doing some great work, and I'm excited to hear more about it.
Okay, thank you so much, Dr. Price. I guess we are in a different world, first of all. It's nothing like anything I've ever experienced. And I think that one of the things we have to just come to grips with is how great this is, how big this is. It's bigger than anything that we've ever even planned for. And so when it first started, we started hearing about the virus and people were kind of panicky, okay? And some are still now. But one of the things we decided to do here in Birmingham with our Cancer Awareness Program is try to galvanize all of the survivors in one setting. And we did a Zoom conference call with Dr. Spencer, one of the science doctors at UAB. And she was able to kind of share with us what is happening on the medical side of it. Because one of the concerns of when I was talking to different patients is that what do we do now, the cancer patients, how do we get service now? Because this corona thing is taking over everybody. And so she reassured us that patients will still be seen, all new cancer patients will still be seen, and that we don't have to worry so much about not getting the services we need if you really need them. Now, they did say that if you just got a cold, stay at home, if it's nothing serious. But she reassured us that if people needed follow-up visits, they would do those. But if they could do the telehealth conferences, they would do those also. So that was a great impact, and it really did help ease some of our worries. When you think about this whole virus thing and staying in the house, I'm a very outgoing people person, and I like to be around people, and I like community people. And so it was very hard for me at first because here I am in the house all the time. And so like Randy was saying, we started doing the Zoom conferences, and we do those maybe every other week for different type of groups. And one thing you said, Dr. Price, that really resonated with me is with family and friends, trying to get those people together on a regular basis to still have that personal contact, even if it's not physically personal, and just kind of talk. I have a group of ladies in my age group that we meet every other month for lunch. And so we did a chat and chew on Zoom one evening, which turned out to be great. They really loved it. And so it's those kind of creative things that we're trying to do. I still walk every morning. I was walking before all this happened, so I'm still doing the same thing. Try to get at least 5 miles in a day. I'm so proud of myself because past couple of days I've been doing 7 miles, and just trying to keep my focus not so much on the fear factor of it all, but how do we work through it? And so we've also set up a series of conferences that's coming next couple of months really for cancer survivors to kind of tune in and see what's happening and how to keep their sanity in all of this. And then also to focus on how we can continue the work of advocacy. I think it's so important that we don't get so bogged down in this coronavirus syndrome that we forget there's a world out there that still need our help. And so we still have to do the advocacy work. I'm so excited about what this panel is doing and what it brings to the community. And so I just hope we can continue these type of sessions. And we're trying to do that on our end also. Thank you.
All right, thank you so much, Loretta. Yeah, advocacy work is needed everywhere,
Yeah.
and you're right. This part of our lives has changed us in some ways, and our ability to get out and about. But it shouldn't stop us from connecting with people. There are so many ways for us to stay connected, and we are communal as people, so we need one another.
Right.
So we just have to shift our mindset in how that looks. I love that. What's that? Sip and chew.
Chat and chew.
Chat and chew. Chat and chew. I'm gonna be putting that on a website somewhere. Chat and chew.
Yeah.
I love that. Thank you.
Don't
All
forget
right.
the Zoom happy hour as well. That's a good one as well.
Oh yeah. Oh
Oh, happy hour.
yeah.
Yes. Okay. See, I love this. We're coming up with so many, catchy and interesting, fun new ways of staying in community with one another. So I
Yeah.
want to turn it over now to Miss Erin. Erin, share with us, what this experience has been like with you, anything that you have learned from it, and ways forward.
Well, the timing of this is for everybody was tough. Our particular group of long-term survivors, I'm a long-term survivor of Hodgkin lymphoma, and most of the folks that I connect with are also long-term survivors. And there's two things. One is that we were planning our first conference to connect in person with a lot of hugging going on. First time many of us who've been in touch with each other for years would have been able to meet in person. And that was supposed to happen this June in Boston. Shelley was scheduled to speak. We had some speakers who are experts in long-term issues coming. And to cancel that was really painful. And yeah, we can do a webinar, and yeah, we can do Zoom, and we will be doing Zoom meetings, probably less for the educational informational reason and more so that we can stay connected. The real purpose of this conference was to get together and share our experiences with each other. I noticed that the different Facebook support groups, however, kind of picking up the slack for that really well. And they're sharing information, and they're sharing ideas, and they're sharing compassion and sympathy. Some people are really struggling. Most of us who have been down this road for a period of time, myself included, have had some pretty serious long-term effects from our earlier cancer treatment. And that involves heart damage and lung damage, secondary cancers, breast cancer, serious immune deficiencies, and that all adds up to being severely at risk. And I think we all came into this knowing that we checked far too many of those boxes. So, and this is true for all cancer folks, it's survivors, it's true for people walking around outside. But when you know that you are high risk, I think it really forms your behavior in some very different ways. And we talked about this earlier, but I think it's important that we be able to say to our friends and even our family, I can't do this. I have to stay protected. I'm really at risk. You might be able to do it. I just can't. Please understand. I'm just trying to stay alive here. And while that sounds dramatic, it's actually the truth. There's so much that we don't know. And I think that sharing information has been really helpful. But I think advocating for yourself as a person of risk is probably the most important thing we can do to feel empowered again. And let's face it, that's what this is all about, is just feeling the lack of control, the lack of ability to really care for yourself in the way you need to. If you know you're putting off treatment, if you know you're putting off an operation that you need, that means you're going to be frightened, and that's where we're at. So yeah, I think the connection piece could not be more important right now. I've been alone for going on 6 weeks now, and it's not easy. I lost my dad last week to COVID, and I had to mourn him completely alone, and that's something I never expected to have to do. But the outpouring of grace and respect and caring that I got from people, even through a computer or on a phone call, was fantastic. And it made me realize that I'm apart, but I'm not alone.
Imani, you're muted.
There we go.
Thank you.
Back to what Randy said, we're having those technology challenges. But I was just saying, Erin, amen and amen for what you said. And, my heart and prayers go out to you and your family during this difficult time.
Yes.
But I'm so happy that you feel community. And even though the community may not be in person, you know that there are people who are still available to you, people that you can reach out to, people who care about your well-being, and people, if you need them, you can access them as needed. So community, you're right, is everything. So,
Yeah.
All right, Miss Sharon. Sharon is here from Richmond, and when we were talking earlier, you were talking about some of the hot spots down in Richmond and your proximity to them. So share with us some of your challenges, some of your triumphs, and some things you've learned as a result of this.
Okay, good morning, everyone. Can you hear me okay?
Mm-hmm.
Yeah. Okay, all right. So one of my first challenges was, of course, just like you mentioned at the beginning, Dr. Price, that this brings you back to the beginning stage of your cancer with your PTSD and a lot of things that goes on. So as an advocate, we always advocate that early detection for, mammograms, self-exams, and with appointments being pushed back, rescheduled, along with that come a lot of anxiety. And I received a phone call telling me that my appointment was going to need to be rescheduled, and I was not having that. It was nice enough that one of the supervisors got on the phone from Massey Cancer Center here in Richmond, Virginia, and actually explained to me that it's different if it's just a routine mammogram versus a diagnostic mammogram. So she clearly told me, still do your self-exam. If you have any problems, if you feel any lumps, bumps, whatever, we will see you as long as it's written up as a diagnostic. That was enough to, settle me down. So I try to share that with other cancer survivors because they are feeling the same thing. Even just as early as this morning, some of their concerns is that I really want to see my physician. It's not the same. They can't do lab works over the phone, so it's not the same. But when I relate to them that if it's something like that related to, breast cancer, they still will see you, is what I'm being told. So still continue to do the self-examination. Also at Massey Cancer Center, we have a new director, Dr. Robert Wynn, who is, in my opinion, very approachable. He came into COVID-19, so he has to focus on that first, but still I find him very approachable. Now, some of, our concerns, again, is not seeing our physician, but once you understand what is really going on, I'm also hearing from patients that they are getting mixed messages. We're not together, people are saying different things. And I think that's because they're still trying to figure this whole thing out. So some of the things we can do is just like we're doing now, have the Zoom conference. We definitely can stop eating. I know I can stop eating. Yes, definitely do that. So what we are doing is the conference as well. My organization, Saving Pennies for a Cure, we practically, when we are not at a conference, we're not out advocating or delivering, we kind of live in the grocery stores, because one of the things that we do is shop for the necessary items for our chemotherapy patient. We are unable to do that now due to risk. We also are unable to deliver in the infusion rooms as well due to risk. So this have really, COVID-19 have really changed things, made us rethink things. So what we are doing now is actually teaching other people through Zoom and through webinars how to actually save every penny, how to clip your coupons and save every penny. So pretty excited about that. We actually have a class coming up tonight. So that kind of helps still connect you with people. I do encourage everyone to get out and walk. You may have to just put on your earbuds and walk alone. I encourage cancer patients to keep everybody out, and you stay out as well. So that's some of the things that we are doing. We are very concerned here in Richmond about Canterbury nursing home, because we actually have made national news, and that's not anything you want to make national news about. As of this morning, I could be wrong, but what I'm showing or what I'm seeing is 45 deaths. That is, Canterbury is 2.9 miles from me. Some of the workers have test positive. So if it's only 2.9 miles from me, that means that we probably go into the same grocery stores and things like that, which is only the grocery stores and the drugstore. So for a cancer patient, cancer survivor, you have to be super careful, very, very careful in what you do. But lending support, try to shift and lend in support, because we cannot get in the infusion rooms right now. We understand that, and we definitely respect that. I have started encouraging everyone to reach out to their providers. I reached out to one of the providers that, I'm finishing up a clinical trial. And, one of the things was, hey, hope everyone's doing well. Just wanted to check in. And the email the response that I got back, we are okay, but I lost my dad to COVID-19. And, they have been there with us through our hard time. They're still there with us. We can kind of flip the switch and be there for them, because they're on the front line right now. So definitely, I would encourage everyone, if you're just doing follow-up with your oncologist, radiologist, your surgeon, reach out to them. How they doing? Just as you mentioned, send a card, things of that nature. So we are, those are some of the things that we are doing down here in Richmond, Virginia. So that's about it for me.
Thank you. I thought that was fantastic when you shared with us earlier about reaching out to your healthcare team and just seeing how they're doing, and sending a card. The doctors and the MDs and nurses and respiratory therapists and others that I work with in the hospitals, they appreciate those cards, those little things. They appreciate it so much. It helps keep them motivated and reminds them, even during the tough time, of why they do this. So I think that it's while we're all hunkering in place and figuring out how our new norm is going to look during this season of our lives, then that's something that I think would be wonderful for any of us to do. And those of us who have kids, little kids, grandkids, they can draw pictures and that kind of thing. People love that kind of stuff. So just being able to reach out and staying part of community. So Shelley, I don't know how you want to do it now. Do you want to open it up for questions or?
Yeah, I actually have quite a few questions already that people submitted either before when they were registering for the webinar, and also people have been submitting questions during. So I have a few for you, but I'll start with this one. We have a number of providers on the phone as well, and so I'm combining a couple of questions, but one of the providers asked if would welcome some tips on helping patients manage anxiety and depression related to COVID-19, and also not everyone has access to online offerings. So what can we as providers, but also as advocates, do to help their cancer patients that don't have access to the online offerings other than personal phone calls?
Yeah. Those are Those are really good questions. So I know one of the ways that physicians can help their patients who are trying to manage anxiety and depression is to find out what their social supports are. I know when I'm working with patients, I have a list in my mind of things that might be helpful, but I need to hear from them what makes sense for them. So we're talking about these social platforms, and if you have a person who doesn't have that, then what are the other ways that they can be connected? Do they have a pen pal? Are there groups that we know of that are in the community that we could reach out to, that they might be able to, exchange telephone numbers with these individuals? Talk to our patients about doing the reading, mindfulness. Um, what is their level of spirituality? That often helps to keep people grounded. But just finding out what kind of things do they have in place for themselves, and who are their social networks, and what kind of avenues would be helpful for them. It's yeah, that's kind of how I'm looking at it. But I always believe in mindfulness and deep breathing, relaxation, meditation apps. If individuals don't have smartphones, you can access DVDs, you can access on television, through cable networks. There are just so many ways of being able to access those kinds of relaxation techniques. And many people have books in their offices that have ways of doing deep breathing. So I think just trying to get some of those resources in place and share those with your patients, and teaching them how to do deep breathing, that's something that can be taught in minutes, and having them do it demonstrated in front of you. And that's something that people can do at any time in their when they're at home.
Shelley, can I just add to that real quick? Just one of the things that hearing different thoughts and ideas, is it occurs to me that the focus has necessarily been on what we can't do. We can't do this, we can't do that, we can't go here, we can't go there. But I think if we can remind ourselves, Dr. Price said, of the things that we can do, the things that we do have, we're very focused on what we're living without and how isolated we are. But there are things that we can do. And I think any little pieces that we can pull out that make us feel like we're making a difference or we're taking care of ourselves, whatever it is, it doesn't have to be huge. As we talked about this last night, it's kind of a building block on feeling in control again. Even if it's not the whole picture, those little pieces add up to feeling like you're taking back some of the control that we've lost.
I agree, Erin. It's back to shifting our focus and how we look at things, and what we do still have, and what we still can do within the limitations of either our home or sitting on a porch, sitting outside. All of that is still available to us, and something that we can still do.
Am I on? Okay.
Yeah.
One of the things, this is Sharon in Richmond. One of the things that I forgot to mention that we are also doing, a lot of people, and I think Loretta forgot to mention it too, we spring clean, whatever you call it. And we have a lot of extra things. So if you have a patient that do not have access to the web, but maybe know someone that could post if they're looking for certain things. For example, I needed to ride my bike inside, and I needed it's called a trainer to stationary my bike inside. I post that online, and within 1 hour, I had 2 people. One person said, "Hey, I'll donate it. I'll put it on the porch." My husband went and picked it up. We sprayed it with Lysol. Great. And just last night, someone was on there. It's another nonprofit that help pregnant moms. I have tons of baby clothes. They are welcome to it. So I think that if they could network with someone that I clearly understand that they do not have access to online, but if they connect with anyone that perhaps could post for them, if they was looking for something, even if they wanted to get out on a nice day and said, hey, this country road, maybe I can ride a bike. I think you will be surprised right about now what people are willing just to donate.
Very good. Very good. A comment too along those same lines. I don't know, can you hear me? Am I on?
Mm-hmm.
Okay.
Yeah.
Along those same lines, one of the things that I found is that when this thing first started, a lot of us, including myself, did not know what a Zoom was. And so I'm still faced with the challenge of getting people to understand the use of social network and the internet. And I have people in my circle who are still fighting against it because, like yesterday, it took me an hour to get my sister hooked up to Zoom because her husband had put the tape over the camera because he didn't want anybody looking at him in his house. I don't get the logic in that, but that's how he felt. And so we're in a society where you have this group of people who don't care about social media, not going to do it no way, no how. And then you have this other group that we have to acknowledge who are really on board with social media and actually actively using it. And so how do you get those two groups of people rather, on the same page? Because one of the things we know that in this particular society we're in is we're being forced, I call it stretching. God is stretching me. And so I've had to step out of my comfort zone and do some things that I normally wouldn't do, like doing a webinar and putting on these different mediums so that people can find out about health issues. And so, but there's still this group out there that's fighting against it because they just don't want to fool with it or just don't know how to, you know. And it took me like 30 minutes to get my sister hooked up to it and tuned into Zoom. And once we got it done, it was okay. But a lot of people don't even know things, simple terminology like a search engine. You say, go to Zoom and key in your search in your Zoom. And they're going, what's a search engine? What's an address bar? You know, simple things that we take for granted. So the number one thing is that we as advocates have got to be more patient with people. And that's the conversation that I'm also having with the medical community, with the telehealth conferences, is that there are a lot of people that don't even understand what you're talking about. I had one group that I met with for my nutritionist, and I think it was only 2 or 3 that got on the line. And one of the people that I noticed wasn't there, I called her after the conference. They couldn't figure out how to get on. So we have to be more patient with people, and even in our instructions, sharing with them how to get onto these different mediums to get the help that they need, get the information that they need.
Well, for people who may not be savvy when it comes to Zoom and some of the video chat, conference calls have been around forever. And
Right.
most churches and other organizations do conference calls. I think for people who may not have computers or access or even know how to access different types of social platforms, they do have a phone and they do know how to do conference calls. So depending on your audience, it might be more beneficial. It may be beneficial for us to consider what platform we're going to use. Maybe we use Zoom for some things, but maybe sometimes we use good old-fashioned conference calling because everybody knows how to dial a number and everybody knows how to dial a code. So,
Yeah.
you know, those are some options too. And most of us who are connected to a faith community or a social organization in some kind of way have been doing conference calling. We started conference calling with just our family doing Bible study over 10 years ago. So now that we see that they're doing it in every church, we're like, oh wow, we were ahead of our time. But that's something, and I think that it would, you know, there are some hospitals and other medical organizations that also have conference calls where they're
Mhm.
reaching out to patients and giving patients the avenue to have a voice and to talk about what they're feeling and have people on there who can help man those feelings. So conference calls are another way for people to stay connected and to have community. And it's easy and simple, and it's something that people are pretty familiar with.
And I would like to add that I observed something the other day that there was actually, you could do a live version of that because at one of the parks nearby my house, there was a tailgate party where a bunch of people they were all staying, keeping their distance, but they were sitting on their trunks and conversing with each other, and they didn't need a phone and they didn't need a computer, and they were having a really, really, really good time.
Right. Great.
That's great. So, Dr. Price, I have a couple of questions. They're a little bit related, so I'm going to ask you both of them and let you respond to them. So, one is how to deal with feelings of guilt when you're able to work from home and earn a paycheck while you know others are losing their jobs and really struggling. And this is, I guess related, but a little bit of a different question, but I thought you could address them both. How do you deal with managing the loss of friends with metastatic cancer during these difficult times and trying to help support people, support survivors, but at the same time, you're grieving the loss of people either to metastatic cancer or to COVID-19?
Yeah, those are wow, dealing with the guilt. Those are big ones, and as it pertains to you working from home, and then also people being sick and losing loved ones from the COVID-19. Managing the guilt because you're able to work from home. Whew, let me think of that. Let me think through that just a little bit, because that I I guess the thing that's kind of coming to mind is that the unfortunate part about what we're experiencing is that there are sacrifices that are being made from all of us. And some of us have been able to take our occupations and have been able to do them online, where others have not been able to. So, if you are familiar with someone who unfortunately has not been able to have a position that they're able to do online, one of the things that you may want to do is find ways to help support them. Find ways that you can contribute. It doesn't necessarily have to be financial. It might be helping them to find resources that can help pay things during this time when they are unemployed. It might be helping them to find um, food pantries, things getting delivered. I know that some banks and other people are also putting off payments for several months until some of this, until we start to figure out how we're going to get this community back working again. But I would encourage you to turn the guilt into advocacy and support. Because I think that there is a real way that we can continue to help people, even when our situation, and particularly because our situation may look different from theirs. So reach out to those folks, see if you can provide something for them, be of help, um, find ways of finding resources for them, and just being present. Sometimes people just need to have a place to take their grievances, to take what they're feeling, how they're feeling, be available to them. So I would say, that's one way in helping if your job is been able to transition to um, virtual and others have not. And it's sort of the same way for, supporting people who are either sick or have lost loved ones. Be present for them. Find ways of being able to connect. Stay in connection with them if they've lost loved ones. Seeing how you can help support them. I think using yourself while staying safe, but in whatever way that you can, that maintains your safety and the safety for a person that you love and care about, will help you to help them. And ultimately, we feel guilt because we feel like we have something that someone else doesn't have, or we've been blessed in a way that someone else hasn't been blessed. Well, take that and turn that into help, advocacy, support, and finding resources for the person that you believe is needing your help or support.
Yeah, that's great. Also, I would just say gratitude too. I mean, that helps a lot. I know I feel a lot of gratitude that I have a job that I can still do from home, even if I'm trying to do it while homeschooling kids, or maybe not homeschooling, that might be a stretch, but at least trying to oversee that they're getting some schoolwork done. So I have one more question, Dr. Price. You talked about the importance of sleep, but I'm hearing a lot of people are having difficulty sleeping, whether it be falling asleep or waking up in the middle of the night, not being able to fall asleep. And so what advice do you have to help people sleep better?
So I think there are a couple things that people can do to sleep better. Number one, it's looking at some of the reasons why we can't sleep. Is it because of racing thoughts? Is it because we're trying to figure out how we're going to get through this? If it's because there are so many things that are going on around us that it just makes it impossible. There are so many reasons why we can't sleep. So I believe in good sleep hygiene. And so we talk about making sure that the bedroom temperature is correct. Try not to take naps during the day. If you have a lot of things on your mind, try to have a notebook or something next to your bed so you can write those things down. So when you're falling asleep, you don't have that you're taking to bed with you. Or if you wake up during sleep, you can have a place where you can put that. Do things like apps. There are all kinds of apps and even things that are on YouTube that will help with white noise or background sounds, or doing some level of mindfulness meditation that helps you to go to sleep at night. Um, some people exercising helps. So and everybody's different. So this is the tricky one. You have to see if you're one who exercise makes you rev up, or if you're one who exercise gives you that sense of calm and helps you to fall asleep. But exercising before you go to sleep can also be helpful if that's one of those things that helps you to relax so that you can go to sleep. Um, I'm drawing a blank, but those are some of the major things that I would encourage people to do. Oh, also be mindful of what you're reading and what you're watching before it's time for bed. So I encourage people within an hour of the time that you want to fall asleep, try not to watch anything that is scary, suspenseful, high energy, any of those kinds of things. You want to put yourself in a position where you're slowly starting to relax to get ready for time for going to sleep. Also, eliminate caffeine late in the day because caffeine can impact one's sleep. And if all of those things, if you're trying all those things and all those things fail, I would say check in with a mental health provider and go over some of the things that are going on in your mind that you're having a hard time turning off, and seeing if having someone to talk to about those things, if that will help you to have a better quality of sleep at night.
Great. Thank you. And I want to end on one last question for each of you, which is, what do you see any silver linings in this situation that will help us in the end after we get past this pandemic? How about Sharon? Do you want to start?
Okay.
You're in the top left box of my screen. So.
Okay. I feel that during the holidays, people are very nice. They come together. Christmas, everybody's cheerful. I actually see the same thing for the most part now. For the most part. So if we could keep that up, if we could just reach out and touch someone. I mean, I'm still sitting here thinking about the providers that said, what do I do? My patients may not have access. contact some of these grassroots organizations. I'm in Virginia, but I welcome a call. I would happily call and talk to whoever, a survivor, patient, whatever. So, you know, my thing is that, yes, I see the silver lining and reach out and touch. And I'm not talking about touching the refrigerator. That's what I'm being, the reason I say the refrigerator, because I keep reaching for my refrigerator. So, so that's exactly what I say. Be patient, reach out and touch, and definitely do not forget first responders and providers and whole staff, and just flip the table. That's what I see.
One thing I would like to
Great.
add is that I think has been really beneficial from this is to slow down. And because I know we all, for the most part, race through this world at a really rapid rate. And I think that this has given some eye-opening opportunities. Just sit and take a breath, look out a window, and chill, and just enjoy the moment and enjoy who you are and what you've got. Be beneficial. Be thankful for that.
Great.
Yeah.
Loretta?
Okay. I guess my major takeaway is that there's always hope in everything that comes along in our lifetime, and that we have to find the positive in everything we do. I talked to some healthcare providers this morning. I have a granddaughter that's a nurse practitioner at the University of Alabama in Birmingham, and we're trying to figure out how we can help them. And we're going to provide dinner for them one evening. And I have a daughter-in-law who works at another local hospital, and we will provide lunch for them through our Cancer Awareness Network program. So we have to figure out ways to stretch ourselves, but we have to also figure out ways to help others. I firmly believe that no matter what situation we're in, if we can just take the focus off of self and see how we can help somebody else, how we can reach out, as Sharon said, how we can touch somebody else and just make their lives better, then we'll begin to see that there is hope and there is a silver lining. And I think we're all going to get to it. It's going to be hard, but I know we're going to make it, because I still have that hope. And I don't believe that any type of fear, I think fear is a regular, normal thing that everybody have, but to have a spirit of fear is to be in bondage. And I don't think God wants any of us to have that spirit of fear, so that we're in bondage, looking over our shoulder, trying to figure out what's going to happen next. And I just love what Randy said about slowing down and looking at one day at a time, taking a moment to breathe and watch the trees. I was walking and looking at the birds and the animals this morning. I'm going, wow, you know, it's such a beautiful world that we have. We got to take time and look at it and really absorb it and enjoy it, because there is a silver lining. And we're going to get through this, guys. We're going to do it.
Thanks, Loretta. Erin?
I think the silver lining for me has been learning how little I need to be happy. There's so much we're living without right now, so much we can't do, but I don't need that, you know, double pump mocha latte at Starbucks. I'm living with that for a long time. Things I don't need, you know, I don't need to go out to dinner. I don't need a heck of a lot. What I need is people. I need my family, my friends, my neighbors. It's made me realize what's most important in my life. And to stop and have to think about that has been a good lesson for me.
Yeah. And
Thank
I
you.
would say that stopping and smelling the roses, I love what Randy say. I agree with it also. Use this time to reflect and relax and just to figure out what's important in your life. Learn a new skill, do things that you're passionate about, and just take it a day at a time, knowing that we are here in this situation. We're in this together. This is all of us. And there is love and there's support and there's hope. We're going to get through this together.
Great. Thank you so much, all of you. Thank you, Dr. Price, for sharing your wisdom and insights. And a big thank you to Randy, Erin, Loretta, and Sharon for sharing your experience and hope. They're all members of our Cancer Policy and Advocacy Team, or CPAT program. CPAT is our program for survivors and caregivers to engage as advocates in public policy around the needs of cancer survivors. We've talked a lot today about advocacy, and so CPAT is free to join, and you can find out more about it on our website at canceradvocacy.org/CPAT. We are planning to do some small group virtual chats for CPAT members in the near future, so please be on the lookout to sign up. Thank you again to everyone for joining us today. We look forward to presenting future webinars and podcasts on COVID-19 topics and beyond. Hope you have a wonderful day and stay well.
Thanks.
Thank
Bye.
you. Thank you.
Bye,
Bye-bye.
Bye, everyone.
Bye.
Thank you.
Okay, are you sure? Yes.